The experienced nurse does not always see more. A seasoned nurse may walk into a room and recognize a problem before anyone else can explain it. The nurse notices the patient's color, voice, position, breathing, movement, expression, and level of engagement. A family member's unusual anxiety becomes part of the assessment. A small change in blood pressure becomes more meaningful when considered beside a rising pulse, poor intake, and reduced urine output. The experienced nurse may appear to possess information that others do not have. Often, the nurse is seeing the same information differently. Instead of viewing each finding as an isolated fact, the nurse sees relationships. Instead of asking only whether a number falls inside a reference range, the nurse asks whether it is normal for this person. Instead of waiting for one dramatic sign, the nurse recognizes a cluster of small changes moving in the same direction. Instead of stopping when the task is completed, the nurse returns to see what happened afterward. This ability can look like intuition. In reality, it is often rapid pattern recognition built through repeated exposure and reflection. The experienced nurse has seen what happened the last time a patient became unusually quiet. The nurse remembers the person whose increasing confusion appeared before a significant fever. The lesson has been stored not merely as a memory, but as a pattern. Experience must be examined. Working for many years does not guarantee sound clinical judgment. Experience becomes wisdom when we examine it. We must be willing to ask what we noticed first, what we almost dismissed, which finding changed the decision, what happened after the intervention, what delayed the response, and what we would do sooner next time. Some of our greatest lessons come from situations we wish had gone differently. A missed finding can teach us what deserves attention. A medication error can expose a weakness in a process. A difficult conversation can teach us how to communicate more clearly. A near miss can reveal the safeguard that prevented harm, and the system failure that allowed the danger to develop. Reflection turns these experiences into knowledge that can be used again. Without reflection, we may simply repeat the same year of practice many times. The nurse brain development cycle. Throughout this book, we will return to a continuous process. Know. Build the clinical foundation. Understand expected findings, medications, procedures, risks, and standards of care. Notice. Observe the person. Recognize what is present, what is missing, and what has changed from baseline. Connect. Bring the findings together. Look for clusters, relationships, contributing factors, and trends. Prioritize. Identify what cannot wait. Determine which problem could cause the greatest harm if action is delayed. Anticipate. Ask what may happen next. Consider complications, medication effects, deterioration, and the consequences of waiting. Act. Complete the safest next intervention. Communicate, clarify, delegate, or escalate according to the situation. Reflect. Evaluate what happened. Determine whether the intervention worked, what was learned, and what should change. Wisdom. Carry the lesson forward. Allow the experience to improve what you notice and how you respond the next time. The cycle does not end. Wisdom becomes part of what you know when the next situation begins.